Much so. I think fortunately men are spared the flashes and the
Right.
and the night sweats, et cetera, et cetera. But I think moodiness does play a part in it to some extent. Sometimes a little depression.
Yep.
And definitely muscle strength.
Yeah. Sometimes I think it's like, I tell the guys, it's kind of like, you got to go mow your lawn, and it's like you'd find anything not to. Whereas on testosterone and feeling good, it's like, babe, I'm going to go mow the lawn. It's Saturday, I got to go do that. You just do what you got to do. I feel like your career flourishes a little more, your relationship flourishes. You just have more energy, Go to the river, go on a trip, go for a drive, whatever. It's just, you have just a little more energy.
Yeah, I don't think there's any question about it. It's it can be tremendous, and from mood all the way up through to increased libido, everything. It's got good cardiovascular protection,
right?
Bone osteoporosis, protection against osteoporosis. Wow, you can go on and on and on. Cognition,
Dementia. So let's talk about that bone, because it was later in my notes, but how do men, so there's many men that have osteopenia or osteoporosis, which is bone decline or bone fraility. So we, women, get bone protection and brain protection from estrogen. So how do men get protection? Because you guys don't naturally make it.
No, but we don't make it, except that the testosterone, it's in a process called aromatization, does aromatize to estrogen.
Right.
So, and that's, I think, a commonly misunderstood thing about men. Men have a lot of estrogen, and probably is an effective aspect of everything that we think is masculine, yet it's estrogen.
Right. I don't want it.
Yeah, but the reality is that's where your testosterone, it moves into estrogen. So a 30-year-old male, 25 to 30-year-old male is going to have a fairly high level of estrogen based on their testosterone levels.
And we don't worry about 30-year-old males breaking bones.
Nope.
Like from falling, maybe from like a skiing accident, but we worry about 7-year-old men's bones because.
Yeah, and men are a little bit luckier in that they're bigger bones and generally, fewer fractures. That's not anywhere near on the list of fatal or things leading to fatal consequences in males as it is in females. But still, fractures do occur, and it's certainly much better to have good bone density.
Right. So the obvious answer is we don't block estrogen, and I know you don't peruse my Facebook channel, but that was Tuesday trivia yesterday. Is should we block estrogen with men on testosterone therapy? And we don't block estrogen. I know Dr. LaFerriere doesn't either, because we want estrogen, because estrogen, testosterone aromatizes into estrogen, and then that's where men get definitely their bone health and Alzheimer's protection, cardiovascular.
Oh, that cardiovascular, yes, definitely. And just, cognition, wow. Central fat, even, because, estradiol is also good for relieving visceral central fat.
And insulin resistance.
And insulin resistance is another thing.
So do you ever get male patients? I get them occasionally where they come in to see me, and then they always want to know, like, at what point will I be blocking their estrogen? At what point will I be prescribing an aromatase inhibitor? Do you get that?
Yeah, but not commonly. I'd still say that the average male doesn't even know anything about estrogen in his body or care.
Yeah.
Really.
Right.
So guys are they don't read about most of this stuff.
Yeah.
They don't.
Well, I have had a couple, and so then I have to realign expectations, and then why, and then we don't do that because it's bad for your health. Because every study to date shows harm when you block estrogen.
Yes.
Every study to date shows protection when you let estrogen convert naturally from testosterone.
Correct.
Every study.
Correct.
So why would you do that?
I don't.
But why do other people?
I think, what's happened, I think, in, let's say, treatment of prostate cancer is a good example, is that's when it's most widely used, where they do aromatase inhibitors so that they want to inhibit the estrogen coming from the testosterone. And so they've used that. Now, in fact, I just literally yesterday read an article where they're saying that there are so many other potential prostate cancer treatments that are much better than aromatase inhibitors,
Right.
than blocking estrogen. So I think the urology, the people treating these cancers are starting to come around a little bit
Figure
to
it
that
out.
too.
Yeah.
And part of it is because they looked at the mortality rate. Mortality rate is very high in two classes of people: people who have had their estrogen, their aromatase inhibited, inhibitors that used to stop testosterone going into estrogen. But that's the one. But the other one is the men with very low testosterone have a much higher cardiovascular morbidity.
Yeah.
Much higher.
Mm-hmm.
Significantly higher. And so why do you want to get somebody's estrogen level down to increase their risk of cardiovascular disease? I mean, duh.
Right. It doesn't make sense.
Doesn't make sense.
So sometimes I get people that message me on Facebook, with a few things, or on that Tuesday trivia, and I tell them if your estrogen is being blocked, you need to find a different provider. It's not right.
I can't disagree with that.
Yeah. So there's also different kinds of testosterone. You and I typically use cream testosterone, but there's also, so in that, our general population, especially yours, are not childbearing years anymore. They've done with their families.
Yes.
So testosterone cream can cause some infertility issues. So our population we use that on aren't trying to have children, but there are different types of testosterone replacement, like the testosterone cypionate, HCG, which you have to use if you're trying to maintain fertility, but that's super expensive. Doesn't always get the levels up where it needs to be. But the thing that bugs me is some hormone providers that tout themselves as hormone providers will see like a 55-year-old man and give them testosterone cypionate and hope to raise testosterone levels when really it's synthetic. It messes with your liver. It messes with your cholesterol.
I don't use it, so I can't comment on. I know what it. I know some of the downsides of it, but I don't use it simply because lipo cream works so well.
It does.
It's very predictable in what levels it gets.
Yeah.
With the dosage levels that we use. Very rarely do you have someone who shoots off the top with it.
Right.
It's so simple. Compliance is an issue to some extent.
Yeah.
But hey, if you want the
To
results,
feel that right.
do
the work.
Do the work. Yeah,
Yeah.
exactly.
Well,
and one other point I want to make about the things, the injectables. Also, I don't like the injectables. I personally don't use pellets, although that's another option.
Mm-hmm. I don't use pellets because I like when women call me and they're going through a rough time in their life or they're having like bleeding, then you can't pick out and stop and increase because it's all implanted in your body for however long. So I don't use pellets either. But the cream is a much more physiologic dose, and men, dang it, are fast metabolizers, you guys. So you have to use it twice a day. So it's a much steadier. You put it on in the morning, it peaks, then it starts to decline. You put it on at night. So you just get this small parameter of dosing. Whereas the shots, you get this huge spike, this huge peak, and then you're waiting day 7, 8, you're dragging 10, I can do it again. And then you get a big peak, and then...
It's a huge peak.
It's a huge peak, right. People feel great, but then...
2-3 times what the
With
max
the
that
cream.
we usually see with
Yeah,
the cream.
yeah. So those are just some differences. And who wants to be shooting their booty like that many times? It's like, it's thick, you gotta use a big needle.
Yeah.
It's a lot.
It is.
And the cream, I don't think is that expensive. I don't honestly.
No, not at all. It's very, very,
It's
very,
reasonable.
very reasonable.
Yeah, I don't know how much the shots
It's
except
about
HCG.
$30 to $35 a month.
A month, yeah.
Yeah, it's not expensive.
Yep. Okay, so let's talk about the benefits of testosterone, and these go for men and women. So, I always think it's funny when I say testosterone, I think people think sex and muscles.
Well, I think that's because they relate it to males.
Mm-hmm. And anabolic steroids, probably.
And to some extent, maybe anabolic steroids, but actually, the reality is anabolic steroids actually do not. They do build muscle, but they don't build anything else.
Yeah, that's true.
So.
Yeah. So testosterone helps, like you were saying, cardioprotective.
Yes.
Blood pressure.
Blood pressure.
The obvious side effect is libido, which nobody Nobody
Yes.
usually minds. I always tell the female patients, tell your husband I like pink and white roses.
There you go.
Right. Because I'll be getting them from him soon. Protects against
That explains it. I've been bringing home a rose for my wife every week for years.
See? It protects against osteoporosis.
You're turning red.
He got me. And does not cause prostate cancer. And Dr. Abraham Morgenthaler from Harvard has done great work dispelling that myth, if only providers would read that literature, I guess.
That's good.
And I always think, again, men typically don't complain of sexual dysfunction, and even with low, outside of the range low testosterone levels, but that's the obvious side effect. It's anti-inflammatory, so it helps the cytokines and the interleukin-6, which causes inflammation. It reduces that.
Insulin resistance.
Insulin resistance, weight loss, and I just feel like it's magic, like it's zest for life, it's vitality, it's motivation, it's just gumption, like it's just that extra edge that you need to do what you need to get done.
Absolutely. It's interesting though, if I may interrupt or interject.
Yeah.
We have spent, I would say, 90% of this talk on testosterone in males.
Yeah.
And the reality is, I actually find that my female patients, when they get optimized in testosterone, are whooping it up better, happier than a lot of the guys.
Yeah.
So I think, I think we need to make sure that in this talk that it comes across very clearly that women need testosterone.
Totally. And I'm a big pusher of testosterone on both. Yeah, because I think it's just, and a lot of times women will say, well, do you think I need that too? Like if I just do the estrogen, the progesterone, and the thyroid, do I need testosterone? I'm like, girl, you do not want to be without the testosterone.
Yes, I would agree.
Yeah. So, increases sex drive, more intense, and increases orgasm, skin tone, depression, mood disturbances, strength and endurance. And I will say, you're not going to be Hulk at the gym, because I just restarted at the gym and I'm panting and feel like I'm going to faint. But eventually I'll get there, because it does improve muscle strength. Recovery time, like I have a couple guys in CrossFit that have noticed their recovery time is a little bit better.
Yeah, if they use CrossFit, they need it.
Right, they do, totally.
That's challenging stuff.
Yeah. And it just kind of melts the belly fat, helps with the insulin resistance, helps protect deterioration of muscle, ligaments, joints, tendons, and bones. What else? Can you think of anything else I left out?
No, it's pretty, I think you got it.
Yeah, it's pretty good. It's pretty magic. And I think I did hit a little too much, not too much, but on the men, because I think the men get scared off more than the women do by providers with this prostate cancer and heart attack thing.
Yeah, I would agree with that, actually. Yeah. I'm trying to think if I've had any primary care physicians want my female patients to stop.
No.
That. I really haven't.
No, that doesn't come across like that.
It's surprising that that would be the case, because I think the average person thinks of testosterone in males.
Yes.
Again, and I repeat, I think some of the happiest things that I've had with patients, I mean, in terms of libido is one thing, but in terms of experiencing, much more pleasurable orgasms,
yes.
Clitoral sensitivity, all those kinds of things are very, very real. Vaginal dryness to some extent.
Oh,
too.
yeah. Oh, UTIs in the older women. Yeah.
Yeah.
Testosterone helps lubricate that urethra again and makes it much more favorable.
And then it does all the things that it does for in men.
Right. It's all the same. Yeah.
So.
Definitely. Well, and also sometimes I always think women are the first ones to come in my practice anyway. Usually women between 30, 35, 35, 40, and then men don't come till after. But I think everyone over 40 needs a good workup to see if it's time or, based on symptoms, it's a good time to start to get a baseline. And then also head injuries can decrease hormones in general quicker than normal. So the hypothalamus pituitary axis, those things can get knocked around if you've been in a car accident, been knocked unconscious. So I just don't think you have to suffer. I mean, if you are feeling any of the fatigue symptoms, go get checked out and make sure that you don't need replacement yet, because it's pretty easy. It's just, Yeah,
I think today's day is, times have changed so much. I think the there are so many things that we're eating and putting into our bodies that are also giving us significant problems at this particular time that 50 to 75 years ago was really not the case. And I think that's a big contributor to people starting some of their menopausal symptoms or at least their hormone levels starting to decrease in their 40s, as opposed to and especially postmenopausal women, after they're going into the postmenopausal phase, sometimes earlier now too. I mean, there are all kinds of related things that need to be.
That's right. Because we don't have this huge epidemic actually of fertility issues for no reason, But I have a quote from Dr. Morgentaler, which is Abraham Morgentaler. He's a famous urologist that has dispelled the myth of testosterone and prostate cancer. He said, many people, highly respected physicians among them, have long believed that levels decline as a natural consequence of advanced aging, and that therefore we should do nothing about it. He says that's like telling a middle-aged person that since vision typically deteriorates with age, there's no point in getting glasses. Well, that's silly. I have my readers right here.
Yeah.
So let me see if there's any questions. We got a lot of people watching. Hi, everybody. All right, but no real questions. So we appreciate everybody listening and taking the time out of their day. And for those of you that might watch it tonight, you can always leave questions. You can personal message me if you are embarrassed to put your question on there, and I'll answer it. Just go, if you're on my page now watching, like my page. If you need us, we're here for you. And I always do like to tell people the book here by Dr. Rouzier. Do you sell this at your office?
Yes.
Yeah.
I give it away.
You give it away. So it's on Amazon for like $19. We have it at the office too. But he has a bibliography at the end where he goes through all of the studies, and he breaks down each hormone into a chapter. It's super easy to read, very redundant, very repetitive. So you kind of are like, oh, I think he said that before. I get it. Because we all learn by repetition.
Teaches.
Yes, right. Right. So anyway, we hope you have a great week, and we really appreciate you taking the time, and I appreciate you.
Thank you.
Sitting
I
in.
enjoyed it very much.
Okay, good.
So thank you for inviting me.
We'll see you guys. Bye.